So I have United Healthcare, and I have just received my benefit summary for next year. If I keep my current plan, my monthly premium is going up 52.8%. Let me show you. My premium will be going from an already outrageous $422.04 per month to $644.91. I don't understand how this is legal. I don't understand how this is ethical. I don't understand anything about it. If I didn't have access to the medications that I take on a monthly and daily basis, I would be dead, or I would be so sick mentally and physically that I'm unable to work. How am I supposed to do this? Luckily, because the health insurance that my job provides has become so expensive, I qualify for a tax credit. And so my plan with my tax credit really isn't going up all that much. But still, technically, it is $650 for me to live every month, for me to survive. What is going on in
Lots
this
is
country?
definitely going on about health insurance, health premiums going up. Hey beautiful people, welcome to my YouTube channel. Thank you for stopping by. So credit goes to the creators in these videos. Guys, are you getting rid of your health insurance? Because so many people are getting bills in the mail about next year's health insurance and how it's gonna skyrocket. Some people are paying about $100 now. They're gonna be paying about 600, 700 for health insurance next year. And guys, that is crazy. It's a crazy increase. So these content creators are complaining about how their health insurance health premiums have gone high, how they don't know if they're going to get rid of their health premiums and all of that. Just let me know in the comment section, are you getting rid of yours? And I'm just going to let this video play. Let me know what you think in the comment section. Are you boycotting your health insurance, or you can still afford
I got this
it?
paper in the mail from Get Covered Illinois because Obamacare is being taken away and insurance is changing. Now you got to get it through the state, yada yada. The insurance that I pay for right now is $75 a month, which is already a stretch for me because I'm a grad student. I'm not working that much. So $75 a month is kind of expensive for health insurance, okay? They told me in this paper that I got automatically enrolled to the new thing, to the new insurance. I was paying $75 a month. Guess what I'm paying now? Or what I'm not going to pay, but guess what it went up to? $652.32 a month. You got to be out your rabbit ass mind, because ain't no way that it went from $75 to $652 a month. That is ridiculous. That is so ridiculous. And I feel so bad for people that have insurance and they have to have a certain insurance to go to a certain doctor to get certain prescriptions, and they got to keep this expensive ass insurance. It's ridiculous. It's so ridiculous. That's why we really have to start focusing, like I've been saying, focusing on just staying healthy so that we can have some type of insurance that doesn't cost a lot, but not have to rely on our insurance that doesn't even kick in until you pay your deductible. I don't even have insurance until I pay my deductible off. It makes no sense. I hate the system. I hate the way that it's set up. It makes no sense.
So recently I got a new job, and the cheapest option for health insurance was $75 a pay period. That's $150 a month. Now, to me, that's a lot, because at my previous job, I had been paying $19 a month because my last job, I guess, just had really good insurance. And before that, I was paying $29 a month. So I'm like, I guess I was pampered a little. And I had made a video about how I'm not going to do health insurance this year, and I'm going to switch to direct primary care so I get more out of my health care. But I found out my school requires me to have health insurance. I'm like, oh, okay. So I'm doing some like TikTok research, okay? Just kind of like trying to see what's out there, trying to see if I could find something even cheaper than that, because I don't need anything. I need preventative care, and that's it. I don't want anything else. I'm fine. So I was like, maybe I can find something that's $10 a month. To my surprise, as I'm doing my TikTok research, I find that, oh, I found such a great deal for my health insurance. It's $300 a month. What? I found such a great deal for my husband and wife health insurance. It's $500 a month. What? It's worse than I thought it was. I thought when everyone was out here saying like that their health insurance is expensive, I'm really thinking that their health insurance is maybe $200 a month. Maybe. No, you guys are paying like arms and legs for health insurance. What? So yeah, my new job that I just got, health insurance is $124 a month. And to me, I'm like, I don't want to pay that. But after watching everybody's videos, I'm gonna learn to suck it up and just pay for my health insurance because it's pretty cheap.
An update. 3 weeks ago, our household received a letter from our health insurance provider indicating that our monthly premiums would be increasing next year by a rate of 37% from $950 a month to $1,325 a month for two 30-year-old healthy adults who do not take any medications to have health insurance for next year. It appears as though Kaiser Permanente has spoken too soon. We received another letter in the mail this week that detailed the adjusted increases for 2026. We were told our monthly premiums would be being raised by 37%. Now that number has jumped to 76%. We are currently paying $950 a month. Next year, that will be $1,670 a month. That is a grand total of $20,040 for two 30-year-old adults to have health insurance for next year. I was just barely beginning to wrap my mind around $1,300 a month. Now it's $1,600. I'm at almost exactly $10,000 per person. The federal minimum wage in this country is $7.25 an hour, $15,000 a year. Health insurance is $10,000 a year. As frustrating as this is to deal with, my house can still afford that. But my heart is breaking for all of the households that can't, because people have kids. It is a $720 a month increase to our bill. Do you know how many people can afford a $720 a month increase in anything? The amount of people in this country who are literally going to die. What are we doing? What's the plan?
Just cancel your health insurance. That's the answer. I've had the best health insurance for so many years. Since it's open enrollment, it is showing that I have to pay over $2,000 a month on health insurance. So I decided to actually do my homework for the first time because everyone has this scare like I need health insurance. And so I called the clinic where I have to do 4 scans every single year. And I wanted to know, what do you charge me cash if I had no insurance? This year I just went like 2 months ago and the total cost was $465 that I had to pay out of pocket. I'm like, okay, maybe this is like a $15,000 service and I'm only getting it for $465. That's amazing. Want to know what it would cost with no insurance? The total is $550. Literally less than $100 difference. Meanwhile, I've been paying like $1,500 a month on health insurance. Just now it's going up to $2,000 because it's open enrollment. I called all my other doctors to see, do you take patients that don't have health insurance? They're like, yeah, of course. Some of them didn't want to give me their pricing until I said I might lose my health insurance and they had no option. I called primaries, gynecologists, pediatricians, eye doctors, the whole nine. Every single one of them, less than about $150 per visit. Health insurance is a scam.
So people are asking the question that why is healthcare something that they have to fight for every month? And it feels like no matter how hard they work, the cost of simply staying healthy keeps rising. And families that have to live paycheck to paycheck are being forced to choose, pay the premium or cut something important out of their lives. And the worst part is that nobody feels like they are getting better care, just higher bills. And people are questioning why they pay so much for insurance that they barely use. And some other people are angry that the employers keep offering plans that cover less but cost more, guys. And people are saying that, okay, if they drop their insurance, one emergency room visit can wipe out their entire savings. And the thing is that healthcare should not be a luxury. It should be something everyone can afford, not only the rich. And these rising premiums are not just numbers of papers. They are stress, fear, and pressure on millions of Americans. And the situation is pushing people to rethink the whole system. And they are just asking questions like, why is being sick so expensive in the first place? And why is healthcare tied to jobs? Guys, let me know your thoughts in the comment section. And so many people are saying that when healthcare becomes a burden, the entire country suffers and something has to change. Let me know your thoughts in the comment section about this. I really want to hear from you. And if you're found value in this video, don't forget to like, share, and subscribe. and I'll see you in my next video. Please stay safe. Mental health is important. Ciao.